Like we'll get going. And my name is Kate Kennedy. I am the Healthcare Compliance Analyst for the SCRBH ASO. And now is the time for everyone to please type in your name and organization in the chat field so that we can affirm who is in attendance today. Those that are joining us only by telephone, please email me at kkennedy@spokanecounty.org so that we can record your attendance today as well. A few housekeeping items to note as we get started here. We will cover a significant amount of material, but you do not need to take copious notes, as both the PowerPoint with talking points and the audio video recording of this webinar will be provided to you for your reference via a link in an email within a week to 10 days. As we're moving through a lot of information, we suggest that you navigate to the chat option to ask any questions that occur to you, and we will review those to answer them at the end of this presentation. Thank you in advance for staying focused and attentive as we move through our materials. With us today, behind the scenes, we have Nancy Locke working the technical end of things, and she will mute all attendees with the exception of myself, herself, and Justin Johnson, of course, our compliance officer and director. The actions that you take to prepare for monitoring this year will be very similar to those that you took last year. Next slide, please, Nancy. Today, we will present a review of the fundamentals of a compliance program, key takeaways, and the upcoming important monitoring dates. A month ago, we sent you a link to access the handouts we will review today, as well as the tool and attestation attachments. Again, after we conclude this webinar, we will send another email in a week to 10 days to notify you that the presentation with talking points and this webinar have been uploaded, providing you with the web link to the handouts referenced, miscellaneous tools, templates mentioned, attestations, and the webinar recording. Next slide, please. Contract requirements. Agencies must have their own compliance program. As healthcare agencies, we have industry standards such as HIPAA, HIPAA High-Tech, operational practices, and other national and state regulations. Conjointly, as healthcare agencies engaged with the utilization of public dollars, we must be vigilant in complying with our compliance programs and be prepared for Medicare and Medicaid audits. The False Claims Act empowers the government to investigate and bring civil action in fraud cases. The federal anti-kickback statute prohibits the exchange of anything of value for referrals or services that are payable by a federal program, which, in the context of healthcare agencies, is Medicare. The Office of the Inspector General has the authority to exclude individuals and businesses from participation in federally funded healthcare programs. The Stark Law applies to physician referrals and may also be called the Federal Physician Self-Referral Law. No further detail on these is provided, as it has been provided in previous presentations. If you need further detail, please contact me, Kate Kennedy, directly. I'm going to briefly review the 7 fundamentals of a standard compliance program, all of which you will find in greater detail in our QM10 compliance plan and its procedures. The first fundamental is ensuring your written policies and procedures have all the required elements to support your general compliance and fraud, waste, and abuse program. This is a list of our policies and procedures related to our general compliance and fraud, waste, and abuse plan. QM10 is the main policy and procedure which refers to all of the other policies. Policies and procedures covering all of these areas are on this slide, are directly associated with your compliance monitoring template tool. QM10 describes our compliance plan and program in detail and includes our procedures and processes for meeting the requirements, including the fraud and abuse policy language, which requires all employees to report any potential fraud. Fundamental number 2 is the requirement to have designated compliance professionals. It is considered best practice to have at least one dedicated and designated compliance professional for your compliance plan and program that does not work in the operations of the agency and that reports to the governing board. For the Community Services Department, my work as the Healthcare Compliance Analyst is a dedicated full-time position and is identified as such on our organization chart. I am located outside of the operations of our programs and report to the Compliance Officer. Justin Johnson serves as the Compliance Officer, and he reports directly to Spokane County's executive leadership and provides all compliance reports and information to the Spokane County Governing Board. Our compliance team is made up of 7 additional individuals that help us to address HIPAA, information systems, fiscal, program integrity, contract monitoring, and office administration. Our compliance committee meets quarterly or more frequently if needed. The third fundamental is having the required training materials and performing effective training at the correct intervals, for example, upon hire and annually thereafter. Complete training records such as sign-in sheets or individually and originally signed attestations for all annual trainings like HIPAA, general compliance, fraud, waste, and abuse is required. Maintaining annual policy and procedure attestations stating that staff have read and understand agency policies is also required. Oaths of confidentiality are to be obtained and maintained for all staff types on an annual basis. The SCRBH ASO has elected to combine the oath of confidentiality process with the annual HIPAA training attestation process, as you can see in handout 10. Standards of conduct forms must also be obtained and maintained on all staff. It is best practice to update these annually. By all types of staff, we mean employees, temporary, part-time, full-time, leadership, board members, volunteers, interns, consultants, and subcontractors. You must retain compliance training and documentation records for 10 years. For those agencies who have elected officials as their governing board, like we have at Spokane County, using the elected official's oath of office as their conflict of interest attestation is sufficient to meet this requirement until we are advised otherwise by the Healthcare Authority or the MCOs. The fourth fundamental of a basic compliance program is to have effective ways to communicate compliance to your employees, governing board, the Spokane County Regional Behavioral Health Administrative Services Organization, other funders, and your subcontractors. The fourth fundamental includes advising your employees and the individuals you serve on how to report a compliance issue or concern. You must have multiple methods of reporting issues for staff and individuals served, such as in person, anonymously by phone or electronically, email, phone, mail, and fax. This also means ensuring your employees know who to contact regarding serious compliance concerns. If you need to know what information should be collected for reporting purposes of a compliance incident, refer to your SCRBH ASO contract or feel free to contact me and I'll email you a blank sample of what we use. We strongly suggest that you post flyers in employee break rooms for employees and on public bulletin boards for individuals you serve. In so doing, people will know what options they have for reporting general compliance, fraud, waste, and abuse issues or concerns. The fifth fundamental of a basic compliance program is enforcing standards. The fifth fundamental of an effective compliance program includes enforcing the standards of conduct with your employees and subcontractors, which may involve sanction policies or other relevant human resource policies, completing corrective action plans to ensure quality improvement and to meet contract compliance standards, and modeling high compliance standards as an agency as you engage with your employees and your clientele. The sixth fundamental of a basic compliance program is to perform monitoring and to verify your internal compliance controls. External monitoring preparation includes attending trainings like this to prepare your compliance staff to know what is expected. It includes responding to monitoring report recommendations and findings, asking questions, creating corrective action plans as needed, and implementing the necessary changes and improvements for meeting compliance requirements. Internally, it includes data validation and reconciliation with funders that you send data to for reimbursement. Ensuring your policies and procedures are current and valid by reviewing them annually for accuracy and appropriateness, reviewing, documenting, reporting, and responding to critical incidents and grievances, peer reviews, supervisors checking their employees' work, and having an employee track your contract deliverables for timely delivery. The last and seventh fundamental of a basic compliance program is promptly responding to compliance issues. Regardless of how a compliance concern, incident, or fraudulent activity is reported to you, your compliance officer needs to be able to promptly review the information and begin an investigation. If it involves SCRBH ASO funds, you need to notify us immediately, and we will determine if we are required by our contracts to report it to the state MCOs or others. You may decide to report it to the state yourself, but you should check your contracts first, as MCOs may want to report it instead of having you do so. SCRBH ASO prefers that you report it to us first, and then we can discuss whether you or we will report it to additional entities. You will need to decide the next steps in the investigation depending on the severity of the issue or incident and your agency's policies and procedures. This process could potentially involve your executive leadership, your human resources department, legal counsel, law enforcement, and your governing board. You will need to minimally plan to produce an investigation report for the reported incident and log the reported incident for your records. If it involves SCRBH ASO funds, we may require a repayment to us and or a corrective action plan be completed to address and prevent the incident from reoccurring. If it involves the healthcare authority, the Department of Social and Health Services, or one of the MCOs, more actions and information may be required than what the SCRBH ASO requires. Lastly, under the seventh fundamental, evaluating and assessing your compliance program's risks annually is required, along with documenting a mitigation plan called a risk management plan for addressing at least the high and medium priority risks. Our risk analysis template and risk management plan can be emailed to you as an example for your agency to consider by emailing me, Kate Kennedy, at kkennedy@spokanecounty.org. Please note, the risk analysis template contains different criteria than our IS HIPAA risk analysis template, but the methodology is the same. Next, Justin Johnson will provide you with an overview of this year's monitoring requirements.
Hey, good afternoon, everyone, and welcome to the section where we talk a little bit about your monitoring requirements. We are not attempting to redo what we've done historically. So if you have been a part of this process in 2023, it's going to look quite similar to what you did in 2024, or will look quite similar as to what we are doing to do in 2024. So not major or significant deviations. The goal for this is to make it easier and not to be duplicative in the expectations and requirements that both our agency and others may be required of your contracts. That being said, there are certain elements that we are required. So we do want to cover those and kind of what the expectations are. So for those agencies that are non-crisis, that do not have a crisis provider contract with us, it will look different than those that have a crisis contract, as well as the non-crisis contract services. There are some agencies that have unique or special programs. They would be subject to the non-crisis contracts and the specific monitoring therein. Now, it may be reduced for those agencies that aren't providing direct BHA services or licensed BHA services under that. However, we are required to ensure compliance across that entire spectrum. So for those agencies that may be doing informational or engagement processes for us, they're not directly attributable to a BHA license and services covered under the SERI. You would have somewhat of a reduced engagement for that. However, we would still require that agency have a compliance program, that there be compliance integrity, so that there's some methodology for that agency to be able to identify fraud, waste, and abuse and be able to address that. And also that there is a system of quality control that's being implemented so that there is recognition that all dollars that we are expending, federal, state, and local dollars, meet the statutory requirements necessary under the state and federal requirements. So that's just a little preface there. I don't see any comments or questions in the chat there, so I'm just going to jump right in. If you have any, please put them in there. Otherwise, we'll go right forward. So as I was indicating, if you are a non-crisis program without a crisis contract, you'll be provided 3 key areas: compliance monitoring tool specific to the non-crisis contract, your program attestation, ensuring that your program meets the requirements necessary for program integrity. And we'll talk a little bit about what that means. And then you're also going to be identifying your training, what specific elements that you're implementing to ensure your staff and the requisite leadership are trained to be able to identify and implement follow through in case of a suspected and or identified fraud, waste, and abuse, and or any program compliance issue. For those that are a crisis entity, you will be incorporating the similar aspects of review, as well as the elements necessary for the crisis review under the contract with the state and federal government. There's a specific and subset of requirements, as we've discussed before, that are very specific to how crisis program services are implemented. Again, for our 6-county region, there's 4 agencies. So just because you provide crisis services does not mean you're a crisis provider entity. I'll just reiterate that. You'll know if you are, and if you are, then you'll be implementing that crisis program review, which includes a review for our agencies programmatically and clinically. Those will be occurring this year. They are required annually. So you'll have essentially 3 reviews: program, compliance, fiscal, and clinical, all of which will occur within this year. And as part of the clinical review, there is also the IS review. So I understand that seems like a lot for a lot of agencies that are providing crisis services, but we try to reduce those to the minimum necessary as per the contract and statutory requirements. Next slide. Excellent. So as part of the expectations for what this review will look like, you can refer to our compliance plan and program under QM10. We identify all of our policy procedures as is required. So this is a great reference point. If you haven't read that, I would highly recommend it. And it is a requirement as part of the review of our contract with your agencies. But essentially, it identifies those key areas that we'll be reviewing. As I discussed, it is going to be 3 for each, but is specific to either non-crisis or crisis. So that's imperative that you review those. You will be submitting those specific to those services. Question that's come up is, if you are a crisis provider agency and you do non-crisis services with us, do you have to submit 2 tools, essentially both for the attestation, the review, and the program? No. We wanted to streamline this. So you will either go down each track, crisis or non-crisis, and all inclusive of crisis services for those that are providing that will include both. You'll have 3. Basically, your monitoring tool, your general compliance and fraud, waste, and abuse attestation, and then your training attestation. Those will be the 3. For the non-crisis, you will have the same. So it'll be all inclusive for the crisis side. That's really where it's going to be a little bit more expanded than what others are seeing. Again, this is made to make it streamlined for the process. Those are what is going to be required in terms of your review. So we do expect that all 3 of those will be submitted. Do you have and have maintained the necessary components throughout the contract year? Or do you have a program and does it continue to remain compliant? And have you trained all your staff on that program? Those are the 3 key areas that we'll be monitoring. So that will be submitted to each of the agencies through Kate Kennedy, our compliance analyst, and then it'll be reported up to me and confirmed. As part of that review, we're going to hit some key areas within that. Again, we have to reiterate the training for this is to prevent fraud, waste, and abuse to whatever extent we are able to identify and ensure that there's follow through, that there is a designation and review of the compliance officers to train as part of that process, that there is reporting structure that allows for all of that to be rolled up to leadership, be it a board and or director, that there is consistent training for all new and ongoing staff, and more importantly, that there is clear and definitive engagement. So when new staff and part-time, temporary, and or volunteers are engaged, this includes subcontractors that may be temporary, also are recognized what that integrity program looks like, and they're able to train and follow through with the expectations necessary for an integral program. That's oftentimes where it's a little bit more complicated that agencies overlook. So please be aware that we will be looking at sub-delegated entities. That's if we delegate to you and then you delegate it out, you need to ensure that you're in training and enforcing those compliance integrity programs with all of those individuals. Next slide. All right. So, as we have said, and as most of you have already know, because this is something that you currently should be required as part of your Medicaid contracts, we do and accept and do expect that you're implementing that training, but it could be inclusive of other trainings that are provided. The number one training that meets the threshold of all expectations for not only our fraud, waste, and abuse program, but also all of the Medicaid ones, is the CMS, fraud, waste, and abuse. This is free and it should be available to your team. It's not the most exciting, but it definitely covers all the necessary components. Please, if you have not done that or not aware of it, that is the minimum standard necessary to ensure the review for the fraud, waste, and abuse integrity program training standards. So that is going to be one of the requirements that we'll be looking at. Do you have the necessary components that meet that minimum standard? Now, some agencies have elected to have their own internal training. We will be looking to ensure all those elements covered under the CMS, fraud, waste, and abuse, is covered under internal trainings. Now, as part of that, that is a coverage of all federal programs, but doesn't include specific state of Washington requirements. So that's going to be something additional that you'll have to ensure as part of your training program. The false claims reporting, which is a statutory compliance of Washington State as part of the not only the state's funding on all levels, that includes behavioral health through HCA, as well as Department of Commerce and DSHS, but it is also required as part of Medicaid funding that is tied to other funding within the state of Washington. So ensure your programs have the false claims and reporting standards training that is required by the state of Washington. It includes all necessary and required arrangements for staff to report either anonymously or directly to the state. Those are key elements that will be necessary in the program. And that includes all required components necessary in reference to the funding source specifically that you're receiving. For those agencies receiving Department of Commerce, there are specific guidelines contractually that you'll need to manage specific to what the reporting structure looks like. But all end up reporting, or at least have components that report up to the state auditor's office if and when a suspected fraud, waste, and abuse incident is known. As Kate had mentioned earlier, we do want that reported to us. Oftentimes, it's easier if you report that to us first as part of the process so we can be aware of it, because we may have additional reporting requirements in conjunction with the state that need to occur. However, we also recognize some of the programs are ancillarily connected to Medicaid. So if we're paying you and the Medicaid as well, you'll be simultaneously reporting to all three, the state, the MCOs, and to us. And we would defer to your program as to what the reporting structure looks like. It is a requirement to notify us. That is an element that if any of the funding that we are providing to you have any connection to the fraud, waste, and abuse, suspected or otherwise, needs to be ensured that you follow the reporting timelines directly to us. So that'll be part of your training. We need to know that's in place. For the non-crisis agencies, the same exists. You'll be, for the crisis agency, you're receiving the Medicaid. So you'll be following the same protocols that you would do for your managed care organization contracts. But for the non-crisis agencies, again, this is just the same level of expectation, but it isn't Medicaid specific dollars, but would be expected to reach the same level of follow through. I want to make sure there's not any questions here. Sorry, I thought I saw a chat come through. Seeing none. Moving on to the next slide, the risk analysis template. This is, again, as part of the process of reviewing, we do identify what is potentially risk, or at least within your agency, a potential risk. This is part of a integrity program requirement. So not only should you be able to train and identify potential fraud, waste, and abuse if it does occur, but also where are the areas within your program that potentially have the ability for exploitation if there isn't clear and concise follow through. That is anything from only one person being responsible for signing off on funding requests, or having no secondary review process for your fiscal team. These are all elements that could be potential risks associated with your program. It could be also that requests are received through an invoice that only a secondary staff receives, but none of the follow through at the higher level where those are actually certified or reviewed. Again, all potential risks. And so this is where your agency will complete the template, review the questions we ask to ensure that there is a compliant process in place. And if there was any risk identified, then we would work with the agency to determine, hey, what is the process moving forward to end up mitigating that risk, or at least putting in new policy procedures to help further potential risk in the future. So that'll be a requirement. You'll see that, again, for most agencies have been through this process, not new. You'll be doing the same thing. We don't expect that there should be any new risks unless you have new funding that you haven't identified, or you've lost a certain capacity or staffing that could prevent follow through and or have a clear and concise measure of control in place. Next slide. Part of the process when you submit your risk management and or your monitoring tool, we highly encourage that previous years where you've been monitored and there's been identified risks, that you incorporate that into your current risk and monitoring review plan moving forward. So for the agencies that had any or had the potential of having identified risk, those would need to be identified in this year's risk and how that was mitigated. For previous years, when you identified that there was a ability for your agency to mitigate that risk, that we would also be incorporated. Please utilize previous reviews as part of your process moving forward. This is not only helpful for us to be able to identify where you are at in your compliance program, but more importantly, helps reduce the onerous responsibility on your agency to have to resubmit new documentation. Again, we are trying to mitigate the burdensome requirements as part of fraud, waste, and abuse compliance review. This helps us to be able to help you because we'll be working on previous year's review. Again, not having to rebake the cake or start from scratch, building on what we have done and what we already know your agency is doing. Again, it is imperative that you continue the training, which does occur annually, but as part of your compliance programming, that's important. Next slide. And as always, there is no point in having a compliance program if you do not have it publicized. Why is this important? Well, how do your staff, even if you receive training, know how to report it? It is a requirement, not only contractually, but statutorily, that you ensure all information necessary for your agency and individuals that work for your agency have a methodology for them to be able to report compliance challenges, issues, or fraud, waste, and abuse reporting failures, either through identified concerns that individuals have seen throughout their own program, or external entities that have identified challenges or potential fraud or suspected fraud throughout their own engagement, either with your agency or through programs that your agency might fund. This is important. This is important because there is absolutely no way that the external public or those that are receiving funding would know how to report unless there was some way to be identified. Even if you train them, oftentimes on an annual basis, no one remembers that information. It is a requirement. So we expect that you will have not only a policy procedure for how this would be implemented, that you are demonstrating that both on every platform possible, meaning it's not a flyer that you hang up in one room of your agency, be it on your website, be it as part of a welcome area when individuals come into your agency, or as part of your informed consent notification process to individuals. Any one of those would be acceptable and expected as terms of engaging. Not only that, for your sub-delegated entities that are providing a service, information, especially as part of their contractual process, would be expected as well. Hey, if you see this or if there's a concern, how would you report this? This is important for you to be able to identify that you completed this area, but not only that, that we can ensure that that program portion of your compliance is in effect. Next slide. All right, so as part of the policy procedures, you will have to have your staff sign off on. Again, This is not new. Most of your agencies already have this. I know this because you all tested to this and completed this last year. Now, for new entities that might be joining us, we expect that all policy procedures necessary to identify the fraud, waste, and abuse program are identified and that your staff are trained on those, and that those are clearly documented as part of the training process, as well as that there is clear documentation from compliance officers that this occurred. So it's not sufficient to say everyone went to a training and we signed off on a letter and there's no indication that the staff was there or not. There needs to be certification that they attended it, as well as certification from the individual they understand and have completed it. That is the minimum necessary to ensure that you are meeting their compliance program for your staff testing so that they're aware of it. Does it necessarily ensure that they have read all 400 documents? Well, that's the intent, is that they have. We recognize that there's constant need to be reflective of this, which is why we require it annually. But it does ensure that we can verify that you have that compliance integrated program within your agency. Next slide. I think one of the challenges that we find for agencies is that they often take on volunteers or sub-delegated entities that provide services as part of their program, and they may be temporary. Oftentimes, the rigorous nature of training them is not always incorporated. That's the element that we're going to be looking at. If they're temporary and or you are training students, ensure that they all go through it. That's what we really require. Because those are one of the major failure points in an integral program, is where there are individuals who may not be aware of those standards or aren't as familiar with how to report or engage those. So please be aware of that if you take on training interns, students, or sub-delegated entities that may be temporary in their engagement of services with your organization. Please remember, as always, I'm just going to reiterate this, for your agency, it is required as part of any new hire that this is done within a specific set of time. This should be a part of your program. This shouldn't be new, but you'd be surprised at how many agencies, especially with workforce challenges, don't implement these necessary trainings within the required 90 days of hire. So just please be aware that it's required for all entities that are working with your agency, that are engaged with any services that are funded by our services, and really any services funded by the state or federal government. Next slide. Part of the training document will also ensure that your agency provides a conflict of interest documentation. This part will be identified in your monitoring tool, and it is shaded, which means we are informing you as part of that process that this is a requirement, so that it is identified within the document itself. Please ensure that all of your agencies' monitoring includes we are recognizing this does include the conflict of interest. Now, this is a statutory requirement, so all agencies need to ensure this, both with their sub-delegated entities and their staff. Next slide. We're almost through this section, so bear with me here. Part of the review will also ensure all agency documentation for compliance ensures record retention. Now, there's been a lot of changes in record retention this year with the state, but the timeframes have not changed. So your agency must ensure that the retention documentations for all documents funded through the state for behavioral services meets 10 years. Now, some documents may not require the 10 years, but it's always good practice to ensure that the highest standard possible is always the safest one to go with, because if you don't know and you end up shortening that years, this could be an impact. Now, there are other requirements. We refer you to the state's current recommendations and statutory compliance documentation on records retention and how you would do reporting on that end. However, for our entity and how we review for this, we would reflect to all statutory requirements and contractual expectations, the minimum of which is 10 years. This will be identified as part of the review process, to which you have a policy procedure necessary to ensure this, as well as compliance training to ensure your staff are aware of this requirement. Next slide. One of the challenges that we find with, especially even with our agency is, okay, so what about exclusions for the monitor? Like, who are we going to exclude because we have determined in advance that they are not as included part of the program, or that you have excluded as part of your training that we would not be reviewing anyways. Challenging part of this is like boards. So for example, the Spokane County Board of County Commissioners does have a conflict of interest and training requirement, but technically speaking, they are statutorily required to a certain level that may not require the same day-to-day expectations for the engagement that our staff do. We would require that they meet all requirements necessary. So if and when we exclude them, it's only as such that those entities would not be required either by law or by contract. So please be aware that if those are identified, that those clearly have been referenced to some statutory compliance and regulation and or contractual regulation that would essentially exempt them. In the monthly review tool that you submit, this is also part of the requirements. So we'd also recognize that ongoing as part of the process, we identify that, but we just want to be very clear on that. Any questions before we go on to the next one? I think one of the major challenges, and we see this too, is that entities generally exempt some leadership or some board members. The statutes don't necessarily exempt all board members. It requires all entities that have direct engagement for any services that are directly funded have the requirement to be trained and have some inclusion in the process for an integral program for compliance, fraud, waste, and abuse. Because even those entities, when they sign up for funding, have the issue of conflict, have the issue of potential fraud, waste, or abuse, and should be identified as a potential risk for the program if there's no training and or review or compliance program that incorporates them either prior or after the fact, both signing and or certifying documentation. If there's no double check and or review for that process, those, again, could be failure points for fraud, waste, and abuse. So please be aware, those are areas that we do look at, but we would work with the agency. And for those that have been through this process before, you already know this. All right. And I'm not going to reiterate this one too much, but remember, subdelegate entities, it does require that you do this. This is another area where we identify that there's usually challenges. This could be your doctor who provides a subset of services within your agency, psychopharmacology. They may not be on site, but they're doing telehealth work that would still be required. So we're seeing a lot of that in form of telehealth services. Yes, they do need to be reviewed and trained for fraud, waste, and abuse, and attest to that. To what extent or rigor, we would defer to your agency to meet the minimum requirements necessary for this contractual expectation. But for the purposes, we do identify that there are necessary training requirements that all entities, when you subdelegate, do. So far as your agency is able to verify that they are completing it, that is sufficient. For example, we contract with a group of different doctors that review our on-off hours, our services for utilization management. They complete a wide variety of compliance trainings. Submission of the completion of those, meet those minimum requirements necessary for the federal government as the state would be sufficient to meet the requirements necessary that there is a training. But they would still have to attest that they did that your agency would need to provide. So even if your agency isn't directly doing the training, you need to ensure that there is training and that they have attested to that so that your agency can maintain those copies, including the BAs necessary to ensure that the information being shared meets the requirements for HIPAA compliant, as well as 42 CFR requirements for sharing of privacy information. Again, not new, should not be new to anyone, but we do expect that any of your agencies ensuring this will have documentation to support it. Any questions? Seeing none, I will bounce this back over to Kate to take over for the remainder.
All right, key takeaways. Please review your documentation compliance plan, policies, and procedures, as well as the way your agency documents your compliance reporting and attestations. All agencies are encouraged to pay special attention to the requirements specifically noted on this page and the next, as these are historically weak areas, warranting additional review consideration prior to signing the attestations. Next slide, please. This slide is a recap of the balance of the highlights of the greatest opportunities for improvement from former monitorings. In preparation, your agency will complete and return the SCRBH ASO the following 3 items: the monitoring tool, crisis, non-crisis, or both, general compliance, fraud, waste, and abuse program attestation form, general compliance, fraud, waste, and abuse training attestation forms, crisis, non-crisis, or both. Submit these as soon as possible, but no later than August 30th. Next slide, please. The first of 3 critical items your agency will be submitting this year is the monitoring tool. With option 1, whereby your agency meets all monitoring tool requirements, then your agency returns a blank monitoring tool. With option 2, whereby your agency does not meet all monitoring tool requirements, then your agency includes a completed monitoring tool with any requirement gaps documented in the results column and the related mitigation plans identified in the agency response column. The SCRBH ASO may request supporting documents at any time, so maintaining clear documentation is expected of all agencies. Next slide, please. The second critical document for this year that your agency needs to complete and sign is a general compliance, fraud, waste, and abuse program attestation form. There are 2 options on this attestation form. Oh, I had a lot of caffeine today, didn't I? Option 1, when your authorized representative at your agency signs the general compliance, fraud, waste, and abuse monitoring program attestation form and checks the first attestation box, you are affirming that your agency is fully compliant with the monitoring tool. In this case, the agency is not required to complete the monitoring tool items and submits a blank monitoring tool. Option 2, what if your agency does not fully meet the requirements? In that case, your agency needs to complete the monitoring tool, stating what requirements you can and cannot meet, and for the items you cannot meet, include your agency's mitigation steps for addressing each deficiency in the monitoring tool. You would then sign the attestation form, placing a check mark in the second attestation box. Again, the SCRBH ASO may request supporting documents at any time, so maintaining clear documentation is expected of all agencies. Next slide, please. The third critical document that your agency needs to complete and sign is the General Compliance, Fraud, Waste, and Abuse Training Attestation Form. There are 2 versions of this attestation form. Version 1 for crisis agencies specifies staff have taken the CMS required trainings and been trained on the Washington State False Claims Statutory requirements. Version 2 for non-crisis agencies specifies staff have taken either the CMS required trainings or comparable compliance trainings and been trained on the Washington State False Claims Statutory requirements. Your agency must sign and submit this attestation form and be prepared to provide supportive documentation upon future requests by the SCRBH ASO. A frequently asked question, what if my agency did not get training completed by March 31st? We understand that there are delays sometimes. However, the goal should be to complete them by the first quarter of each year. Another frequently asked question, what if I am both a crisis and non-crisis agency? Do I provide both? Yes. Next slide, please. This year, as in past, we are allowing for e-signing or signing and scanning of the attestations, and they still must arrive on or before the due date of August 30th. For the attestations, e-signature capabilities have been designed to be available with Adobe signature format. User instructions are provided in the handouts explaining the Adobe e-signature process. If you have designated signers at your agency that would like additional training on e-signing, please contact me, Kate Kennedy, at KKENNEDY@SpokaneCounty.org. All right, next slide. Let's talk deadlines. Your agency needs to submit your agency's 3 documents to us on or before August 30th. We will endeavor to have everyone's results compiled and get those provided back to you by September 30th. As a reminder, I'm seeing 33 participants, and I don't think I saw that many entries in our chat. So we just want to make sure if you joined us late and have not entered your name and agency in the chat box, please do so now so that we can have an accurate listing of attendees for today's training. So in that chat, you want to identify your name and which organization that you're with. Next slide, please. Here we are at the question segment. Nancy, do we have any questions that have come in from attendees that were not answered?
We don't yet.
All right. Well, now our forever hold your peace. Does anyone else have any other questions? Justin, did you have anything else to add? All right.
Kate, nothing more to add, only that if and when question comes up necessary for, hey, how does my agency get access to trainings? Or can I reach out to Kate to talk through direct questions that may be more nuanced? Or I'm a new agency and we don't do direct behavioral services. How do we ensure compliance for the dollars that we're receiving, but we're not actually providing any direct privacy protected information to individuals? For those agencies, please reach out just directly. We can provide whatever is needed as part of that process. Again, there's going to be some nuances because we're covering all of the non-Medicaid and additional services, which may or may not have a direct or clear expectation for some of these. So please reach out to Kate or myself if you have any specific questions, and we'll be glad to answer any of those.
And Nancy, the last slide.
And to your question, and yes, we will be emailing out this PowerPoint to our providers. So everyone here can get a copy of this.
Indeed. This does conclude our SCRBH ASO agency compliance monitoring webinar training. To that end, we will be working with county technical staff to upload this webinar and this PowerPoint inclusive of these talking points as swiftly as we can. But that email will probably go out to you in a week to 10 days, and that will have the link to the references, the tools, resources, and presentation. So be looking for that in your email inbox, and that will come from me. Additionally, we will work with our contract staff, Jamie Gadd and Michelle Gerelman, to get your compliance monitoring results notifications out to you in September. So be looking for emails from them with your results of your monitoring with us. So thank you for your time and your participation today.
Yes,
Bye.
we hope it was painless as possible. Please reach out if you have any questions. Thank you all for spending your Thursday evening with us. Have a wonderful day.